The Op Non-Stop study is trying to find out the best way to treat children and young people with Perthes disease. To understand Perthes, think of the hip like an ice cream. The round part of the hip is like a ball of ice cream. This sits within a socket, which is like an ice cream scoop. When the leg moves, the ball moves around in the scoop. In Perthes disease, there is a problem with the blood supply to the ball of the hip joint, which causes it to become soft and change shape. This is like the ice cream melting. The problem is temporary, and after some time the bone strengthens, but the shape stays the same as when it was soft. If the hip becomes flat, it can stop the hip moving well, which may cause pain or limit activities. The study is comparing the two most common types of treatment used throughout the UK and the rest of the world. One treatment is called active containment. This is a package of care including physiotherapy, activity restriction, and pain relief. This involves stretching and exercises to maintain and improve the movement of the hip. As the hip recovers, the focus of therapy will change, from stretching the muscles around the hip to strengthening them. The principle is to encourage the soft ball to move and be shaped by the scoop-like socket. The hip will gradually recover, though full recovery takes about 3 years. The other treatment is surgical containment, to improve the position of the hip within the socket. Children will be given an anaesthetic to make sure that the child cannot feel anything. The operation will carefully reposition the bone into the best position within the socket, with either a metal plate and screws or wires used to hold the bone. This encourages the soft ball to be shaped by the scoop-like socket. The child is often put in a plaster cast to rest the hip for about 6 weeks. The hip will then gradually recover. Full recovery takes about 3 years. In the Op Non-Stop study, half of the children with Perthes disease will have active containment, and the other half will have surgical containment. The choice of treatment will be decided fairly at random. Once we have enough children in each group that are similar, we can compare the two groups. If you decide to join the Op Non-Stop study, we'll ask you some questions about how your leg feels and how much Perthes disease affects you. We'll ask you questions over the next 3 years as your hip recovers. We'll ask questions by text message or email. The doctors, nurses and research team are happy to answer any questions you have about the Op Non-Stop study.